Thank you, Madam Chair. And I want to thank you guys for the presentation. Great information today, by the way. But I was wanting to ask Dr. Badani, do we have a recovery rate between the vaccinated and the unvaccinated?
So from our experience, patients who end up in the ICU critically ill, about 90% or more of those are unvaccinated, right? The vaccinated is single-digit numbers. And those vaccinated patients are usually patients who have multiple other comorbid conditions like cancer, severe lung disease, renal failure, and other such issues who end up with COVID. And in my experience, I have no data, but in my experience, even those patients with multiple comorbid conditions who end up in the ICU with COVID, they seem to be faring better than the young, healthy ones who are unvaccinated. So in my experience, if you are vaccinated, you are very much less likely to end up in the ICU, which is where my experience lies. And even when you do end up in the ICU, you tend to fare better, even though you may have more comorbid conditions or more chronic diseases that would otherwise have made you a worse candidate for survival.
Right. And the reason I ask that is because I've seen numbers nationally that the recovery rate is relatively close on both vaccinated and unvaccinated. I just wanted clarity on that. But I had COVID back in April, and so out of curiosity, I went and took the antibody test, the monoclonal antibody test. It tested very high, and talking with the pharmacist that done the test said that I'm in really good shape after having the COVID, and that really the level I had would rival the vaccination itself. Would it be possible if we could come up with something to where an antibody test from someone who's already had COVID and got monoclonal antibodies, would it suffice for a vaccine?
So, I'm not an expert in immunology, but immunity from vaccine is not dependent just on antibody levels, right? I mean, a lot of the immunity that you get from vaccines is dependent on what is known as the helper T cells, which are the lymphocytes that are sort of the quarterback for the immune system. So antibodies wane over time. Helper T cells last much longer. Helper T cells help accelerate and exponentially increase your immune response when you do get exposed to an antigen to which you are vaccinated against. When you get the COVID-19 has multiple antigens on it. The antibodies that you develop are against multiple antigens. So a good example is, you got attacked by a 300-pound bear, you used your buckshot and, you hit it in multiple places, you kill the bear, that's good. Vaccine is the opposite. Vaccine, you provide the spike protein antigen. All your antibodies are against that particular part of the spike protein antigen. You now have very high immune levels against that very important part of the virus. So all your immune effort and resources are now directed to the most critical part of that virus. So your chances, in my opinion, and just based on general logic, are much higher to fight off the Delta variant or severe COVID infection if you were vaccinated, rather than if you had natural immunity. Antibodies are a surrogate marker for immunity, but they are not the best marker for how you would respond to a natural infection.
Right. And that question is really geared toward, for the employee shortage that we have, the healthcare workers. If they had had COVID and had high-level antibodies, would that suffice for them instead of taking the vaccine? So I just wanted to ask that question. Thank you, guys.